everyone, I'm Dr. Sarah Lindberg, a naturopathic physician at Sound Naturopathic Clinic, and I'm here to talk to you about the importance of the pulse oximeter, but mainly the oxygen saturation, which is a medical vital sign because it can detect early warnings that medical attention may be needed. So it works because there is a light that goes through and can detect the amount of oxygen that is in the blood. Now, oxygen is circulated through the blood and it is first intaken by the lungs that goes to the bronchioles, which then gets into the blood via capillaries, and then the blood circulates through the tissues, and then once it gets to the tissues, then it drops off the oxygen, and then the blood is unoxygenated and then goes and does the cycle again. So at the fingertip, this is typically where the oxygen saturation is done, and that is because it is the furthest away that the blood will typically go that is oxygenated. So it's a really good quality and true value of the oxygen that is in the blood. The levels that are normal is about 95 to 100%, and if the levels are lower, such as 85 to 90 or lower than that, that is a warrant for a phone call to your medical provider or a trip to the hospital. That means that you're not getting enough blood or oxygen in your blood. And sometimes a pulse oximeter and the oxygen saturation is used in hospitals for long-term tracking of the oxygen in the blood. So conditions that this can be used for are a lot of lung conditions in particular, such as pneumonia, COVID-19, asthma, COPD, pulmonary fibrosis, or even blood conditions such as anemia and heart diseases. So the benefits of using a pulse oximeter at home is prevention. So early readings of low oxygen or hypoxia can be detected to help with the outcomes of, like with the times right now, COVID-19. It can also prevent the need of ventilators when people are on COVID-19 because you're able to see the numbers in the the oxygen numbers in the blood start to decrease. So how you actually use this is you open it up, you put your finger in, you turn it on with the button, and you hold your hand steady, and you just wait for the numbers to come on. Sometimes the numbers may adjust a little bit before it gets to the actual numbers, so just wait. And sometimes if the numbers are a little bit lower than you would like, just take a couple deep breaths and see if the numbers go back to a normal range. You probably just need to breathe. So my number is 99, it just shows up, and that is an adequate number for oxygen saturation. That's it. Thank you for watching this video. I'm Dr. Sarah Lindberg, keeping you informed and healthy.